Hello, I'm Dr. Alan Mercer. Over the past 35 years of practicing family medicine, I have had thousands of conversations with men in their 60s, 70s, and beyond, and there is one topic that almost never comes up first, even though it quietly worries a lot of you. Many men notice at some point that morning erections have become less frequent, or have stopped altogether, and most of them assume this is simply what happens when you get older. It's treated like gray hair or reading glasses, just another sign of the years passing. And I understand why. It feels private, a little embarrassing, and easier to just accept than to bring up at an appointment. But here's what I want you to understand before we go any further. While aging does change the body in real and expected ways, this particular symptom can sometimes be one of the earliest signals your body gives you about circulation, hormones, sleep quality, medications, or overall cardiovascular health. It doesn't mean something is seriously wrong, but it also isn't something to simply wave off. Today, we're going to walk through exactly why this happens, what your body is actually doing while you sleep, and what the science tells us about when this symptom is worth paying attention to. There's a connection between this and heart health that surprises most of my patients, and we'll get to that shortly. Let's start with the basics, because understanding how this process normally works makes everything else easier to follow. Morning erections, sometimes called nocturnal penile tumescence, happen during certain stages of sleep, largely independent of any sexual thought or stimulation. During REM sleep, the part of your sleep cycle associated with dreaming, the nervous system relaxes certain signals that normally keep blood flow restricted, and at the same time, nitric oxide is released in the blood vessel walls. Nitric oxide is a molecule that tells the smooth muscle in blood vessels to relax and widen, allowing blood to flow in more freely. This is the same basic mechanism involved in daytime erections, but because it happens automatically during sleep, many physicians consider it a kind of natural, built-in test of vascular function. Think of it as your circulatory system exercising itself overnight. When this process works consistently, it's a reasonably good sign that blood vessels are relaxing and dilating the way they should. When it becomes rare or disappears, it can be worth asking why. Now, aging blood vessels are part of this picture, and I want to be very clear that some change here is completely normal and expected. As we get older, the inner lining of our blood vessels, called the endothelium, becomes somewhat less efficient at producing nitric oxide. Arteries can also become a little stiffer over time. This is a gradual process that happens to nearly everyone to some degree, but when this process moves faster than expected or is made worse by other factors, it can affect blood flow throughout the body, not just in one area. That's an important point I want you to sit with for a moment. The blood vessels involved in this nighttime process are small, but they are connected to the same overall vascular system as the arteries feeding your heart and your brain. Some research has suggested that changes in erectile function can, in certain cases, become noticeable before other cardiovascular symptoms do, simply because these smaller vessels may show signs of strain earlier than larger ones. This doesn't mean every man with this symptom has heart disease. It means it can be a helpful early clue, and clues are worth paying attention to. Testosterone is another piece of this puzzle, and I think it gets both overemphasized and misunderstood at the same time. Testosterone does play a role in sexual desire and can influence the frequency of nighttime erections, but it is rarely the only factor, and it is almost never the first thing I look at. Testosterone levels do decline gradually with age for most men, typically around 1% per year starting in the 30s, though the rate varies quite a bit from person to person. Low testosterone can contribute to reduced libido, fatigue, and changes in mood, and it may play a role in this symptom as well. But because testosterone interacts with sleep, blood vessel health, mental health, and body composition, it's rarely useful to look at it in isolation. If your doctor does check your levels, it's usually part of a broader evaluation, not a standalone answer. Sleep quality deserves far more attention than most people give it, and this is genuinely one of the areas where I've seen real improvement happen once a patient understands what's going on. Since this process depends heavily on REM sleep, anything that disrupts your sleep architecture can reduce how often it happens. This is where sleep apnea becomes especially relevant. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep, often due to a blocked airway, and it's remarkably common in men over 60, particularly those who snore heavily, carry extra weight around the neck and midsection, or wake up feeling unrested no matter how many hours they slept. Sleep apnea fragments REM sleep lowers oxygen levels overnight and puts additional strain on the cardiovascular system. Several studies have found a strong association between untreated sleep apnea and reduced nocturnal erections. And the encouraging part is that treating sleep apnea, often with a CPAP machine, has been shown in some patients to improve this symptom along with a long list of other health markers. If you've been told you snore loudly, or your partner has ever mentioned that you seem to stop breathing for a moment during the night, that's worth bringing up with your physician. Diabetes is another major factor, and it connects back to those blood vessels we talked about earlier. Elevated blood sugar over time can damage both the blood vessels and the nerves involved in this process, a condition broadly referred to as vascular and neurological complications of diabetes. This damage tends to happen slowly and quietly, which is exactly why routine blood sugar monitoring matters, even if you feel completely fine otherwise. Many men are walking around with prediabetes or early type 2 diabetes without any obvious symptoms, and changes in nighttime erections can sometimes be one of the first things that shows up before a diagnosis is made. Blood pressure and cholesterol work through a similar mechanism. High blood pressure can damage the delicate lining of blood vessels over time, reducing their ability to relax and widen properly. Elevated cholesterol, particularly LDL cholesterol, can contribute to the buildup of plaque inside arteries, a process called atherosclerosis, which narrows the space available for blood to flow through. Because the blood vessels involved in nighttime erections are relatively small, they can be among the first to show the effects of this narrowing, sometimes years before a man experiences chest pain or other more widely recognized cardiovascular symptoms. This is precisely why some cardiologists now consider erectile changes a potential early warning sign worth discussing with a physician, rather than something to dismiss as simply part of getting older. Let's talk about weight, exercise, and nutrition, because these three are deeply connected and genuinely within your control. Carrying excess weight, particularly around the abdomen, is associated with increased inflammation, insulin resistance, and lower testosterone levels, all of which can affect this process. Regular physical activity, on the other hand, has been shown in multiple studies to improve blood vessel function, support healthy testosterone levels, and improve sleep quality. You don't need to become a marathon runner. Even consistent, moderate activity, like brisk walking most days of the week, has measurable benefits for vascular health. Nutrition matters here too. A diet consistent with what's often called a Mediterranean pattern, rich in vegetables, fruits, whole grains, fish, and healthy fats, while limiting processed foods and excess sugar, has been associated in research with better erectile function and better overall cardiovascular health. This isn't about perfection or restrictive dieting, it's about giving your blood vessels the raw materials they need to function well. Stress and mental health play a bigger role here than most men expect. Chronic stress raises cortisol levels and activates the sympathetic nervous system, essentially your body's fight or flight response, which can interfere with the relaxation response needed for blood vessels to widen properly. Anxiety and depression are also independently associated with reduced sexual function, and the relationship often runs in both directions, meaning the symptom itself can contribute to stress, which then makes the underlying issue worse. This is not a character flaw or a sign of weakness. It's a physiological response, and it's worth mentioning to your doctor just as you would any other symptom. Medications are something I always review carefully with my patients because several very common prescriptions can affect this process as a side effect. Certain blood pressure medications, some antidepressants, and a few other medication classes have been documented to reduce erectile function in some patients. I want to be completely clear about something important here. Never stop taking a prescribed medication on your own because of this symptom. Blood pressure and mental health medications are managing serious conditions, and stopping them abruptly can be dangerous. What I recommend instead is having an honest conversation with your prescribing physician. In many cases, there are alternative medications available that manage the same condition with a different side effect profile, but that decision should always be made together with your doctor, not on your own. Smoking and alcohol are two lifestyle factors worth addressing honestly. Smoking damages the endothelial lining of blood vessels directly and has one of the strongest documented associations with erectile dysfunction of any modifiable risk factor. The encouraging news is that some studies have shown measurable improvement in vascular function within months of quitting. Alcohol, particularly in larger quantities, can act as a nervous system depressant and disrupt REM sleep, which, as we discussed, is when nighttime erections occur. Moderate consumption affects people differently, but if you've noticed this symptom alongside regular heavier drinking, that connection is worth considering. So when should you actually bring this up with your doctor? My general guidance is this. If you've noticed a persistent change over several weeks or months, rather than an occasional night here and there, it's worth a conversation. This is especially true if it's happening alongside other symptoms like fatigue, unexplained weight changes, increased thirst, snoring, or any chest discomfort with exertion. When you do bring it up, don't be afraid to ask direct questions. You might ask your doctor to check your blood pressure, your fasting glucose or hemoglobin A1C, your cholesterol panel, and potentially your testosterone level. You can also ask whether any of your current medications could be contributing and whether a sleep evaluation might be appropriate. A good physician will not react with judgment. This is a routine part of health screening for men your age, and bringing it up early often leads to catching other issues sooner rather than later. I also want to clear up a few common myths I hear repeatedly. The first is the belief that this simply means testosterone is low and that testosterone therapy is the automatic fix. As we discussed, testosterone is only one piece of a much larger picture, and therapy isn't appropriate or necessary for every man. The second myth is that this always means something is seriously wrong. In many cases, the cause turns out to be a combination of manageable factors like poor sleep, stress, or a medication side effect, and addressing those factors leads to real improvement. The third myth is that this is simply an unavoidable part of aging that nothing can be done about. While some gradual change is expected, a sudden or significant disappearance of this symptom is different from a slow, gradual decline, and it deserves a closer look rather than automatic acceptance. As we bring this together, here's what I want you to take away. This symptom is not something to fear, and it's not something that automatically means a serious diagnosis, but it is a genuinely useful signal your body provides, one that touches on blood vessel health, hormones, sleep, mental health, and lifestyle habits all at once. Paying attention to it and having an honest conversation with your physician is simply good preventive medicine. Many of the underlying causes we discussed today, from blood pressure to blood sugar to sleep apnea to weight management, are things you have real ability to influence through both lifestyle changes and appropriate medical care. The goal isn't to create worry. The goal is awareness, because awareness leads to earlier conversations, earlier evaluations, and often better outcomes down the road. If this video helped you understand your body a little better, please consider subscribing so you don't miss future conversations like this one. And I'd genuinely like to hear from you in the comments below. If you have questions, or if there's a topic in men's health you'd like me to cover in a future video, let me know respectfully, and I'll do my best to address it. I'm Dr. Alan Mercer. Thank you for watching, and I'll see you in the next video.